So I want to welcome you to our next panel. This one is, the topic of this is very near and dear to my heart because I think as we've both through our own personal experiences and working with people have seen how important understanding and healing trauma is in a person's spiritual journey. And that sometimes there can be a spiritual bypass that makes people not want to deal with that, but it's very important for the grounding and to help make the spiritual journey a bit easier. So we have four wonderful panelists today. I'm going to introduce them one at a time, and they'll each talk for 15 minutes, and then we'll have 15 minutes at the end for questions and answers. So let's begin with Betty Guadagno. And Betty is a truth teller, and her experiences encompass the full spectrum from dark to light. I very much appreciate her courage and candor, and she tells an important story that I think many of us can relate to. She's moved in her life from being a drug-addicted sex worker to working as a recovery coach. So let's all please welcome Betty. Thanks very much.
Hello, family. My name's Betty. I'm dialing in from Brooklyn, New York, and I'm really excited to be here. I manifested this experience. Thank you all who helped me manifest it. And I wrestled with a lot of self-doubt coming into this because, I've been watching over the last 2 days and everyone is so eloquent and they have all these wonderful visuals to their stories. And I had to really put that voice to rest that was telling me that I didn't have anything to share, nothing that's profound. And yeah, like Brian shared, my story is one of transformation, and I'm going to take you on that journey with me. I grew up in a really chaotic, dysfunctional home. My whole family is a perpetual cycle of addiction and poverty, molestation, rape, incest. And so you're taught at a very young age to use drugs to cope with your experience. My parents were both active addicts. Their parents taught them how to use. My parents taught me how to use. And it's just been the story of my family line for generations and generations. And in 2007, my parents, who were both active addicts, made a decision and committed suicide together. It was a profound loss, the most traumatic event in my life, not my first trauma, not my last trauma, but most certainly the most profound. And it gave me this great excuse to keep using drugs. I was already an addict before that, but I felt like I needed drugs to cope with my experience. My whole world was washed in an ocean of grief and stigma and loss, and I didn't know how to cope. And so my addiction told me that I had to keep using. There was one voice in my head that said, you should stop using drugs. Your parents just died from them. And then there was another voice that said, drugs is the only thing that you have left of your parents. You have to keep using. And so I listened to that latter voice, and I stayed addicted to drugs for over 20 years. And my experience, it changed shape. It morphed many times. My addiction grew and became smaller and grew again, and it changed shape often. And I was on opiates for over 20 years, and I became like a kind of like a dumpster for drugs at some point in my life, just any and everything I could get my hands on. I started experimenting with methamphetamine for the last 2 years of my active addiction. If you don't have any experience with that drug, I'm happy for you. It was invented in Nazi Germany, and Hitler was on meth. So it'll give you a little scope of what it's like. It's absolutely insane. It's genocidal. And it took my life into such a dark place so quickly. I also began experimenting with psychedelics. Somebody maliciously gave me an overdose of hallucinogens in a drink. And that dosing caused a series of spiritual awakenings to happen in my life. And I was a devout atheist, militant atheist, not only because my parents were addicts and they didn't teach me about God, but I didn't want to believe in God after my parents committed suicide. I didn't want to think that there was a creator that would let something like that happen. And so I just stayed hidden from God because it seemed a lot easier until these awakenings. And it became real clear to me real fast that my personal pursuit of atheism was misguided and it transformed into something else. I experienced a spontaneous Kundalini awakening in March of 2019, onset by another large quantity of psychedelics, this time that I had given to myself because I was going to go do my laundry. And I thought, oh, I might as well eat 8 grams of mushrooms, might as well be wavy for some mundane human task. And this awakening started to take place in the laundromat. I began to run home because I didn't know what was happening to me. I just thought that I had done too much. And as I started towards my house, every time I got to a corner, the street signs would say Madison and Stuyvesant, and I would run to the next corner and it would say Madison and Stuyvesant again. And it was like I was stuck in a loop and I didn't know what to do. And then all of a sudden the world became washed in this white light. It was brighter than anything I had ever seen or conceived in my life. I made it back to my house and I entered the door, I looked in the mirror and I had no idea who I was. There was no recollection of the person that was staring back at me. And then the awakening started to take place in my physical body. All of my chakras were blasted open and I was transported to the space between life and eternity in a non-physical realm, in blinding white light, enveloped in unconditional love, a feeling that I'll never find adequate words to describe. And I was greeted with some people in my life who had crossed over. My father was one of them. And just, it sort of morphed into the shape of every masculine energy I've ever encountered in my life. So boyfriends, husbands, uncles, grandparents, every masculine energy sort of morphed into this one form. And it guided me through the other side. And while I was there, I just thought that I had taken so many drugs that I was seeing God. You know, I was like, oh my God, I am so high. This is crazy. I'll never be this messed up ever again. And they showed me my pre-birth planning while I was there. They took me through the moments and they let me feel the moments that I, as a soul, picked all of the adversity and all of the partners in my life. I picked to be an addict. I picked to be a woman. I picked where I would be born, the family I would be born into, my parents, their death, the reasons why. And in this moment of being downloaded with this belief, I instantly shifted out of my victim mentality and I rose into my divinity as a co-creator of my experience. Things had no longer happened to me, they had happened for me because on some soul level, I had chosen it for the evolvement of myself. And I begged to stay in that space. They told me that I had to come back, that this was my opportunity to overcome. My book was not finished. My movie was not done being made. There was still so many more classes to attend. And I was going to have the opportunity to be the hero of my story and overcome all of this adversity. All I had to do was just let go of drugs. And I was like, wow, I'm so high that drugs just broke up with me. Like drugs had been my best friend, my lover, my husband for over 20 years. And here I was in this experience and they were dumping me. So I came back from this experience. I just wrote it off as drug-induced psychosis because who wouldn't, you know? And the universe made itself very known to me in a very loud way that this was not some sort of hallucination. This was a real experience that had happened to me, and recovery was my only pathway. My world got very small. Like all of the drug dealers that I had been dealing with for over a decade, all simultaneously decided to change their lives and stop selling drugs. Like people that did not know each other, so that I had no option on how to get them. Drugs began to not work. And I was on day 3 of heroin withdrawal. I was so sick. I mean, sicker than I had ever been in my 20+ year opiate addiction. And I had a thought, I said, oh my God, I'm so sick that I can't even kill myself because I can't even get up out of this bed to figure out a way to kill myself. And in that moment, I heard a voice and it told me to lay back and to ask what I wanted fixed. I said that I no longer wanted to be physically dependent on heroin. And I felt X's go across my forehead, and in a bright white flash, I was instantaneously healed out of day 3 of heroin withdrawal. I mean, you know, for the contrast, you know, I was an atheist. I was an orphan to suicide. I was a prostitute. I was just a terrible drug addict. I had caused so much harm in my life. And there I was being bestowed with the grace of a creator that I did not believe in. And my path became crystal clear after that. I found myself sitting on a train with no destination, so broken, so lost, so confused. And a man appeared across from me, and he was wearing a 12-step fellowship necklace. And I heard a voice in my head and it said, that's your path, follow that man to a meeting. And I did. And that was on June 1st, 2019. And I've been clean ever since. And it's the coolest thing I've ever done in my life. I found myself in another meeting the next day, and I was sitting next to the program director of an inpatient women's therapeutic community here in New York, a long-term rehab. I realized that this was another sign that I needed to enter into a long-term rehab in order to figure out how to be a person. I needed space to integrate my spiritual experience. I had no idea how to be a person. I mean, like, I was the kind of addict that I didn't even know how to brush my teeth without being high first. And so I went to that program the very next day with just the clothes on my back. I didn't want anything from my old life. I was about to be evicted. I was on the verge of homelessness. I didn't take any pictures. I didn't pack any furniture, didn't take any clothes. My most prized possession was a $200 vibrator. So I didn't really have a lot going for me. I figured I could just get another one if I needed it later. And I entered my recovery journey. And while I was in that program, I stayed there for 17 months. And I manifested things inside of that program that I didn't think could be possible. You know, like the teachings of the law of attraction found their way to me. A Course in Miracles, which is a spiritual text that I study, also found its way to me in that program. A meditation teacher appeared to teach me how to meditate and to make me feel understood in my spiritual experience. And while I was there, I got the opportunity to go to school to become a recovery coach. And I actually have a job in the recovery field today, which is just wild. I mean, I used to be a prostitute and a pimp, and I used to manipulate women. I would get them strung out on drugs so I could prostitute them to make money from my own addiction. And today I have this amazing opportunity to make a universal amends, and I assist women on their healing journeys today. And it's more than I ever could have thought for myself. And my integration process has been challenging. I was downloaded with so much information, and I was only allowed to bring back a certain amount, and I get little glimpses of it here and there. And my journey since coming out of treatment and back into the world, having this job where I'm helping other people. I belong to a 12-step community. I belong to multiple spiritual communities. And I feel like my awakening led me to the path to be of service. And so I'm of service in all of my communities. I feel like that really is just the purpose of a spiritual awakening, for my fellow man, for myself, for my service to source. This is what my purpose is here now. They told me that my life was like boot camp, you know, like up until the point of my awakening, I had gone through boot camp, and now it's time for my mission here on earth. And so I got a very strong download that part of my mission was to assist the collective in awakening from a level of third dimensional consciousness to fifth dimensional consciousness. And I do that just by being myself and just being a shining light. It's not about teaching or preaching to anyone. It's just about being myself and holding space. And I know that transformation is possible, because if it's possible for me, it's possible for anyone. I mean, I don't have adequate words to describe to you what kind of depraved animal I was for the first part of my life. And I'm looking so forward to seeing how the rest of my journey unfolds. And this is one of my dreams, just to speak about my experience, to listen to others share about their awakenings and the information that they've gathered. I feel like we all have these beautiful pieces of this very intricate puzzle, and we're all here to paint this beautiful picture together. And I'm so grateful for this space. I'm so grateful for my new life. I cannot explain to you the contrast. And I'm so grateful for all of the experiences in my life. All of the trauma and tragedy has turned into overcoming and triumph. And like I said, if it's possible for me, it's possible for anyone. And I'm really grateful to have this opportunity to share this very vulnerable piece of myself with you guys today. Thank you for letting me share.
Thank you, Betty. How you tell your story is so riveting. And partly, I think your gift is that you connected emotionally with how it affects you. So thank you very much. Okay, our next speaker is Emily Burfoot. And Emily has had one near-death experience and multiple spiritually transformative experiences. She's a founding member of Blue Lotus Network, which is dedicated to a vision of human wholeness and to finding optimum mental health. So let's all welcome Emily. Thanks very much.
Thank you. Thank you very much. Wow, I've been so inspired by everybody who I've seen speak today. So especially Betty just now, and I've really related very much to a lot of the different stories. And I'm looking around for my slides right now. So I wanted to talk about the power dynamics between materialism, which I see as the sort of dominant religion that in the world that we live in, and the spirituality that I've really been forced into through my numerous experiences. So I studied geography, which had philosophy in it at Oxford. And I've always kept that lens of being the objective observer around my experiences, because I've really wanted to use some of the scientific concepts that I've learned to try to educate what I see as a very sort of large hole in the medical profession around understanding spiritual experiences and the way they're dealt with. I believe that all the science is out there, it just hasn't been applied yet. So my first spiritual awakening was in 2005. So this was a very traumatic near-death experience, and I was actually prescribed an antidepressant, which I was told that I didn't need, but I started to take it. And what happened 10 days later, I actually felt like I was falling down a black hole. I was seeing a lot of just truth sort of starting to come out, and I began to disassociate from consensus reality. And when I was at the peak of the experience, I felt like I was witnessing the beginning and the end of time simultaneously. For me, it wasn't pleasant at all, because I was still very much in my mental body. I was still in my ego. And actually, I thought the only solution to the amount of trauma that I was feeling was to attempt suicide, and that's what I did. I survived. I'd never in a million years, when I took the overdose, thought that I was going to wake up, but I did. And I'm feeling kind of envious of some of the people who really remember the conversations that they had on the other side, because I don't actually remember those. I know that they happened because when I woke up in the hospital, I really felt like I'd had this reset in terms of seeing you know, Betty mentioned having the victim mentality just reset. That happened for me. Seeing myself as the creator of my own life, and really wanting to be of service and use my gifts to actually prevent anyone else from having to suffer in the way that I have done. So yeah, on the outside I appear to have had a very privileged life, but inwardly it's been very different, and I've had numerous additional experiences as I've revisited that trauma and attempted to make sense of it. In 2013 I got admitted to psychiatric hospital for the first time, and was put on antipsychotics, which made me really ill. Managed to get off them. 2019 was when I did a big sort of withdrawal, which I did completely alone because I couldn't trust anyone with what I was going through. And since then, it has been a case of just sort of trying to build trust in other people again, because that was really lost with all of this. However, I really want, and what I've always wanted ever since that very first experience, is, as I said, has been to create something of value from this to help bridge that gap between science and spirituality. so that more people can be understood. And like I say, I was really using scientific concepts to make interpretations about what was going on in my consciousness, and always thinking about kind of how how can we integrate what we know in other areas of science than medicine, which is obviously based in quite old science, and actually integrate those new laws of physics into our understanding of human beings. So when I began writing my work, I was really starting to think about how everybody is essentially managing fear in some way. Obviously, when I attempted suicide, I thought, having a very proportional reaction to the amount of fear that I was facing. However, I could see that some ways of managing fear were socially acceptable. You know, in terms of compulsively trying to become more wealthy, for example, is a way of managing fear that is deemed very socially acceptable, whereas these traumatic responses and spiritual awakening experiences are far more taboo and not discussed. And I've kind of speculated on myself whether I have a bit of autism, seeing myself as being very different from the normal people. But I started to categorize all of the different kinds of sort of axes that we have in society, where you have a power dynamic, you know, between men and women, Christianity and paganism and indigenous religions, religion and science, rich and poor, and all of these different ways that we have these polarities and dualities that are playing out in a fight for each other. And obviously, from my vantage point, you know, this is all kind of moot, because there is only oneness, there is only love. You know, there's no point really in putting any kind of hostility or fight into any of these, but that's just my opinion, and I know I'm in a minority there. But I would really like to talk about the spiritual versus material, which is what I see playing out in the psych ward. So as you can see with the slide, the spiritual person needs faith, needs kind of a fluffy, you know, ability to create boundaries. And a religious person needs an adherence to a dogma to feel safe, whereas a materialist really needs the existence of solid things to feel safe. And obviously, with medicine really founded on this, you know, nature of solid things, medicine and you know, being applied to spiritual experiences, you know, there's a need to really invalidate and squash them, which is what I felt as an inpatient. But in many ways, you know, I'm very lucky that I've only spent 5 weeks of my life in inpatient, and you know, many other people are really not that fortunate. And you know, when you start to get to know these kinds of people, and you think, well, actually, if everybody just understood each other a little bit more, there isn't really all this need for control through medication and imprisonment, etc. It's really just about finding a balance between the material and the spiritual, where we recognize the need for both. So then I just sort of wanted to speak a little bit about the kind of black hole experience that I had. So I guess we can say that when physicists talk about matter or light falling into a black hole, the difference of what is observed really depends on the perspective of who's watching. and where you're watching. So if you're at the perspective of the object or the light itself, you travel past the event horizon of the black hole and you kind of keep on going. So you are continuously moving. Whereas if you're somebody who is watching this event that outside the black hole, what appears to happen is that time stops and you sort of never really enter it. And so I feel that this is a really applicable idea for what I've experienced in these mystical experiences and near-death experiences, is that you know, as the consciousness itself, there is no end, but as somebody who is looking at somebody who is passing over, for example, there does appear to be an end. And it's interesting to me that there could be a parallel there. And I wonder how many other scientific laws, such as those governing quantum theory, etc., are really applicable to all of these spiritual experiences and being in more than one place at the same time. And yeah, I just, you know, obviously there's a lot of reasons why medicine is not going there in terms of really upgrading its ideas. But yeah, I just feel that there's so much opportunity to open a dialogue here, because the number of people who are experiencing awakening is, I believe, really rising. And you know, there's a reason for it in terms of helping us to live more in harmony with the earth. So I'd just like to pose this question at the end: just how can we promote more tolerance and understanding of polarity and difference? And just to suggest as well the significance within me of just having as much self-acceptance as is possible.
I had to unmute there. So thanks very much, Emily. Yeah, it's equally mesmerizing, and I just appreciate the vulnerability and the humility and the bravery that both of you have been speaking with. So let's introduce our next speaker. Dr. Marnie Hill Foderaro is an author, a speaker, and an educator. She has a doctorate in education and postgraduate work at Harvard. And she's the author of the award-winning spiritual fiction book, God Came to My Garage Sale. She has had numerous traumatic, spiritually transformative experiences. So let's all please welcome Dr. Marnie Hill Foderaro. Thanks, Marnie.
Sure. Well, hi, everyone. I'm just so honored to be here at SAI. And my life was forever changed when I experienced some traumatic life experiences. I chose to leave my American dream, something I had worked so hard for my whole life. Right before I retired from my wonderful career as a special education teacher, high school teacher for 35 years, and 12 of those years I was an adjunct graduate school professor. I was just going along, living life, raising my 2 children, just believing I was living the American dream. And it became very evident at one point I needed to leave my 27-year marriage. And, you know, there were significant repercussions as a result of that. And I didn't realize how traumatic that, you know, that experience would be, as well as what kind of came afterwards. But I've always been someone who believed in love and honesty and goodness and compassion. And so I just decided to handle this challenge in my life with those same values. And, I hadn't, just so you know, I had an atheist background. I had really very little exposure to organized religion or spirituality in my life. And as I got older, I really sought out some answers to, why are there so many miracles? Just even our bodies, how they can, we can get hurt and then we can repair ourselves. And it seemed like there had to be some divine intervention. And so I decided to seek out organized religion, which I did. And that gave me a lot of answers, and it sort of led me on my path. As time went on, though, I realized that I didn't necessarily need to be in a four-wall structure to experience God and the miracles. And so anyway, I had the strength and courage to leave my marriage. And of course, I had to have a garage sale. I didn't realize I lost everything, my home, my assets, my money, even adult children, to parental alienation, which was just mind-blowing, just shocking for any normal range, loving, empathetic mom or dad, to experience the loss of living children. But again, I was in a state of gratitude, and I had this garage sale. And I would say that was the beginning of my spiritual awakening, was at this garage sale, because miracles happened that I just couldn't explain in everyday terms. One of the experiences that was extremely life-changing, I was stepping away from my home in the cul-de-sac, looking back at my house, really with gratitude, and I could have been angry, I could have been sad, but I was just really in a state of gratitude and thankful for the many years that I had with my children in this home. And a dragonfly circled me. And I thought, well, that's pretty cool. But, I didn't think too much of it. Didn't even think too much of it when there were 5 dragonflies. But within like a 5 to 8 minute time frame, I was surrounded by 50, and then what I believe to be about 100 dragonflies. And I was in just a state of awe. It was like the air was clear jello. Everything was in slow motion. I couldn't really move, but I was aware. And, things were so slow that I could see the veins in every single wing of the dragonflies. And I mean, there were so many circling me, but it was just all in slow motion. I could see the iridescent colors. There were different sizes. I equated them to babies and toddlers and teenagers and grandparents and young adults. And, I just felt like I was being surrounded. And the feeling I had was that of just, Marnie, you're going to be okay. You had a tough decision to make, but you will be just fine. And that was just kind of the start. I have to say that about 3/4 of the way through this experience, I started to kind of come out of this almost like a trance. And I knew to pull out my cell phone and videotape these hundreds of dragonflies, which I did. Just to prove to myself and others, hey, I had this experience. But that opened my mind and my heart and soul to many other experiences, many that happened at the garage sale. But also because I made this, my book, God Came to My Garage Sale, I made it a spiritual fiction. I was able to incorporate other experiences that I had prior to this, as well as after the garage sale. And then I spent a lot of time at IANS, the International Association for Near-Death Studies. In fact, that's where I met Yvonne in Chicago. And, I heard so many accounts, and between hearing hundreds and hundreds of testimonials, which prompted me to read books and listen to other people's podcasts where they explain their experiences, and then just my numerous experiences. I mean, there were just too many for me to ignore. And I knew that some major life change was happening for me. And, there were so many events. I mean, I could just be here for hours and hours and talk about each of the different events. I had deceased loved ones come through electronics, come through a television set. I had specifically colored feathers appear, that were the same coloring of my brother's dog that had passed away the night before. And I looked up, I was in Illinois at the time. I currently live in the Caribbean. I moved to the Caribbean a few years ago after I retired. But I looked up, what kind of bird would have these colored feathers in Illinois, and couldn't find one. But they were definitely the same coloring of my brother's Australian Shepherd. And I had a dream visitation, and I had moments where I felt cool breezes, or I saw someone even levitating. And all of these different experiences happened when I was always in a state of gratitude, which is mostly how I choose to live, but really in a conscious state of gratitude. And one common thread with my STEs is that everything is in slow motion, just complete slow motion. And I can kind of bring myself to that state if I really, it's kind of strange, like I work hard at it, but at the same time I let go. So I'll consciously try to quiet my mind, get into a meditative state, and definitely always in gratitude. But then at some point, I stop all that effort and I just let go. And that is when things just kind of come my way, and I'm able to see things, and I'm able to feel things. And it's just amazing. My life is forever changed because these STEs. And what I would say is, to people listening to this that are like, well, I don't have those gifts, or, I haven't had such a traumatic experience that, has catapulted me into this. I would say I'm an everyday person, just like you and me. I'm just an everyday person, but my life was just forever transformed because of trauma. And I think that, in NDEs, people experience trauma, they flatline, they leave this earth, at least spiritually, and go on to have experiences, and they are able to come back, and everyone seems to be come back with a message of love, that is the highest vibration. So many people come back and are compelled to write a book or speak or somehow share their story, just to bring awareness to others. And that happened to me as well. I always loved writing and reading, but I never thought that in my retirement I would be an author. And now I'm an author of over 11 books. And so this spiritual awakening kind of brought out the author in me. I started out with a spiritual fiction, and I was just so honored that James Redfield, the best-selling author of The Celestine Prophecy, he endorsed that book. But I also had the support of the IANDS community. Diane Willis from Chicago wrote an endorsement, and Barbara Bartolome from Santa Barbara, California. She is the founding president of the IANDS there. She wrote my foreword. And I also kind of reached out to get more answers from psychic mediums as well, and have some endorsements from them too. And, some positive experiences and some negative, and, some really seem to have some special gifts, and some don't. And, but that's okay. I think it's all part of the journey. But, you know, even though I went through some very traumatic experiences, you know, leaving a very unhealthy marriage, and just the loss that so many losses I experienced as a result of this choice I made, which really is the best choice for me. Just even in the deepest dark moments, I was always able to find gratitude and see the light. And I think that has really seen me through so many different, you know, events in my life. And so I would say to people that, you know, are maybe in a dark place, experiencing some trauma. You know, it doesn't have to be domestic violence and parental alienation. Some of the things that I've experienced, the loss of all these material things. Everyone has their own challenge, and we're not here to compare and to rate those, you know, whatever. If something is very challenging for you, just realize if you handle your challenges with love and light, and then if you're here listening, you probably are somewhat open to signs and synchronicities, and they were life-changing. I am now more aware. I just am more aware. I'm not just going through life oblivious and just, you know, going along. Like I said before, living my American dream. I'm much more present, and I'm much more open to the miracles that can happen. And an overwhelming sense of peace has come over me. And I feel like I have found my voice through my pen. But I just continue to live in gratitude, and I'm so thankful for the challenges that I had, because without those, I don't think I would have moved in this direction to be a little bit more self-actualized and definitely more self-aware.
Thank you very much, Dr. Foderero.
Yeah.
Yeah, it was inspiring, and also I think it was helpful in that you were normalizing the role of trauma in these spiritual awakenings. So thank you very much.
Yeah.
So let's move to our final speaker. So Christina Moore had her initial spiritual emergence in 2013, and she is in college and aims to complete a PhD in transpersonal psychology at the California Institute of Integral Studies in San Francisco. And she is a mental health system survivor, and is a co-founder of Blue Lotus, which again is promoting the vision of optimal human performance and optimizing mental health. So let's all welcome Christina. Thanks for coming.
Thank you. Hi, I'm Christina. So I'll just start with my story of how I gained my empathic abilities. Like it said, I started in mine in 2013 at the age of 33, if you're familiar with numerology, master numbers. And I've been told many times when people ask my age about it that, oh, that's a very significant number. And I had been having synchronicities with numbers ever since. I woke up the morning of April 30th, 2013 with an abundant amount of energy after only 2 hours of sleep. And I said to my husband, oh, I think I'm coming to a new level of awareness. And he was like, oh yeah, I'm going to work, you know. And everything was just so vibrant that day. My son was homeschooling at the time, and he decided he wanted to make eggs for me for breakfast. And even the eggs tasted yellow. Like my senses were so heightened that foods tasted more vibrant. My sense of awareness was more keen. I, at one point, felt clairvoyant to where I could hear other people's thoughts in my head. I eventually experienced Nikolai Tesla, the whole science, magic, Jungian archetype. And then it inflated, my ego inflated. I was understanding metaphors like I couldn't before. And I was trying to translate the Declaration of Independence. That week, I was very persistent in social issues at the time, political stuff, and it was really heightening my concern for the global society. By around 5 o'clock is when I was in the thick of it. My husband came home from work, and just immediately when I saw him, I knew I was going into the ER. At one point, I went to touch one arm with my hand, and 2 inches off of my skin, I could feel heat radiating from me and vibration up my spine, Kundalini, right? So my husband took me out to the car, and I honestly don't know how he managed to get me to the hospital safely, because I was speaking with my hands and flaying everywhere on the highway on the way there. We pulled up, and he took me into the ER door, and there was a nurse immediately right there, and I was like, okay. I immediately felt that I was going to be sedated. She put me on a gurney and immediately shot me with Haldol. It was feeling so magical and amazing up until that point. I have an issue with hospitals and medical professionals. I don't particularly trust them because of certain things that happened in my life. But I knew my husband was just doing what he could to help me, because we weren't aware of alternative healings at the time. I was in and out of consciousness in that ER for 3 days, because they couldn't find an inpatient bed for me for 3 days. And I was counting patterns everywhere, synchronicities, just to comfort me so that I could at some point come out of it. At one point, I was sitting on the edge of a bed after the nurse had showered me, and she was braiding my hair. And I looked up on my chart on the wall, and it said, "Christina, keep her safe." And I said, "Oh, I dreamt this." And the nurse just kind of like cast, like, "Yeah, whatever, you know." And she just kept braiding my hair, and she was like, "Your family's going to come in and see you, but we have a police officer coming over and taking you to the inpatient soon." So my family came in, and I said hello, and they knew where I was being transferred to, and so they had to leave. I remember going downstairs to the door to greet the police officer, and I was at the door of the police car, and he pulled out a pair of handcuffs and said, "I don't want to have to do this to you, but this is my job, and this is what I have to do to get you over to inpatient." So he put the handcuffs on me, and I remember immediately thinking, I'm not feeling well. I'm not a criminal. I'm sick. But, it was part of the policies of where we were living at the time. And by the 3rd day in inpatient, I was really relaxed. I knew my husband was taking care of my son, and everything was being taken care of at home. I had a roof over me. I had a bed to sleep in. Meals were at clockwork in there. So I had nothing concerning me. And it was the first time I was like, oh, wow. This is what relaxing and being calm feels like. And I've realized that I had been having chronic anxiety for as long as I can remember. That was my first baseline for feeling calm. When I came out, 10 days later, I had to go see the psychiatrist who had diagnosed me as an inpatient. And her first question was, "Hi, Christina, do you remember me?" And I was just like trying to, the face looked familiar, but I couldn't picture where I'd seen her from. And if any of you have been through the hospitalization part of spiritual emergence, you might know that post coming out, there's a little bit of post-psychosis amnesia that happens, at least with certain memories. Her second question, and it really upset me that she asked this, but she said, "Do you know what's wrong with you?" Real great bedside manner, right? And I was like, "No, enlighten me, please tell me." And she said, "You have bipolar disorder." And I said, "And how did you determine that?" And her answer was, "Oh, you should have seen yourself. I wish I had videotaped you." And I was just shocked. like how, I was sitting there thinking, how the heck did this woman get her psychiatry degree? Because she had no like idea how harmful her words were. And I was like, I would have liked to have seen it too, because it would have been an interesting case study. And so I kind of already had lost respect for her in the beginning. And I want to be clear that not every clinician, practitioner, counselor is like this, but I've had so many bad ones to where I'm now picky about rooting out the good ones. After I left from seeing her, I immediately went and got a journal to make sense of what had happened to me, because in my situation, I didn't feel it was a chemical imbalance. It was a spiritual experience. And so I spent 2 years just writing down everything, every thought I had as to what it was I was experiencing, how I was experiencing, trying to connect the dots of things that I had forgotten. And it was very unnerving. But I just kind of accepted the diagnosis because I didn't know any difference. So 2 years in, on the very anniversary of when my initiatory crisis happened, my husband finally asked me what happened from my point of view. And when I told him all the things I was experiencing, he answered with, I wonder if at some point they'll find out that bipolar disorder is the mind's way of coming to a new stage of enlightenment. And that profound saying was so meaningful to me that the next morning I immediately went and Googled bipolar enlightenment, and a whole new world of healing opened up to me. I found out about Stanislav Grof. I found out about Sean Blackwell's work with bipolar waking up, and it all really resonated with me. And I'm not saying that the chemical imbalance portion isn't there. There's definitely a whole healing situation that needs to go on. But if you don't heal the mental, the emotional experience and spiritual, you're not going to be healed as a whole. So that excitement from what my husband had said excited me into another one. And it was during this one that my husband was actually threatening to divorce me. And that put me in a state of fear, which made the second one like even stronger. And I wound up coming out and going back within 24 hours, but there wasn't a bed for me, an inpatient again. And in that ER, it was so loud and noisy and crowded that I was on a gurney in front of the nurse's station once again. And at one point, there was so much noise of all the machines beeping, people talking, nurses snacking, that I leaned up and there was a nurse right there. And I said, is there any way I can be put in a quieter place so I can calm down? And she completely ignored me. And so I pulled the plugs out of my arm and I went to the bathroom. She let me in to go. She cleaned me back up and got me back to the gurney and plugged me back in with no emotion to it whatsoever, just like she was doing her job. And from my point of view, I could smell the fear on her. Like, so many people in the ER who are working, bless their hearts, they're doing their best they can, but there is a fear there that patients can sense and pick up on. And in my situation, I didn't want help from somebody who fears me. I want help from somebody who understands what's going on, which is why I have come on this journey of trying to encourage people to be their own health advocates and possibly consider coming into the field. So let me start my slides. So what this particular slide is green for, but this is what the ER practitioners aren't taking into consideration. I realized 6 years after my initiatory crisis that, okay, I'm working through the mental stuff. I'm working through the emotional stuff. I had always been uncovering my spiritual self since I was 4 years old. And I realized, oh my gosh, I had never got checked out physically. when I first went into the ER, I was given Halidol and the psychiatrist was sent to see me. There were no blood work tests, no MRI, not even a CAT scan. And even Emma Bragdon in the IMHU course says, the physical should always be checked first every time. So that I never got checked to see if there was a chemical or metal toxin. There could have been a nutrition deficiency. B12 is a major common one. There could have been an autoimmune issue like hypothyroidism or even Lyme disease if you were bit by a tick at some point in your life. For me, when I finally got to see a primary care physician in 2019, he finally sent me for blood work and an MRI. The blood work came back with hypothyroidism. The MRI, although it was small and benign, it came back with a tumor in the pituitary gland in my brain. But because I had never had the initial tests, that first ER visit, I'll never know whether the chicken or the egg came first. And that's why I'm on this mission, is to help people realize that the physical needs to be checked out too, first and foremost. And if our ERs aren't recognizing that they need to do this, we need to be our own mental health advocates and ask for it. So even if you've been in the ER for psychosis before, every time you go in, you ask for blood work and ask for an MRI. An MRI at least the first 2 times. Because if we don't solve this issue, there's going to be more stuck in the system rather than the system changing for everybody's better needs. And it also starts with fixing your own needs. And again, this comes from the bit of the fear I have of the medical industry. I always try to help my own self first. So I went with lifestyle changes. I started initiating exercise, nutrition, and I'm not perfect at it. Part of the reason is because on certain medications, I had gained 50 pounds in under 3 months that I'm still trying to burn off. But if you are in a situation where you can't trust the people who are supposed to take care of your health, you need to at least start with taking care of your own. And it's taken me 9 years to build a relationship with specific people that I work with. And I don't just do the lifestyle changes. I go and I ask people, who is your psychiatrist? Who is your primary care? Do you prefer the holistic route, which I do? And then the major step for me was meditation. And I was also afraid of that for the longest time because I heard stories of people going into psychosis through meditation. But one of my fellow co-founders in Blue Lotus, Rebecca, introduced me to what she calls the grounding cord. She said she learned it from Deborah King. And she taught me to imagine a trunk root from the base of my spine into the earth to tether me to the earth before I meditate. And that made the world of difference. So
About 1 more minute, Christina.
okay, thank you. So the next thing is journaling. And the reason why journaling has been helpful for me is because, especially post-episode, which I've had several of at this point, you don't always remember things right away. Sometimes things come back to you over time. In fact, one of my stays, I was nearly attacked with the intention of sexual assault by one of the nurses in the inpatient, a male nurse. And I remember the nurses coming in and pulling him off of me. And when I came to, I was sitting at a dinner table eating with him right across from me, like as if nothing had ever happened. And it took me a couple of weeks before I regained that memory. So journaling is healing too. And it's usually before bed, I get it all out so that I can sleep. But it's a very, very helpful technique. And lastly, is be your own advocate. Be picky about the people you work with for your mental health. That's the only way we're going to be able to weed out the ones in the system who don't care. Your experience is valid, and you want to find someone who validates that experience with you and is willing to help you through your journey, not just Band-Aid it with the current mental health system. Thank you.
Thank you, Christina. Yeah, yay. All of these are so touching and so riveting, and appreciate you doing that. Just so you know, I'm a licensed psychologist specializing in trauma and abuse, but when I was 21, I was committed to Stanford Hospital for 4 weeks and diagnosed as a paranoid schizophrenic. So I've had that experience many years ago, and that was in response to my spiritual emergency. So it's been happening for a long time, and probably, unfortunately, will continue to go. Well, let's get to questions. So I want to ask the first one, and I want to ask it of all of you. So could you comment in terms of how much do you think trauma caused your spiritual emergency versus it was just making it more intense? And secondly, how did you heal from the trauma of your spiritual emergency? And we'll start with Betty.
Okay.
Okay, and yeah, we'll just go down the same order, please.
So for me, I think that, well, like I said, I was taken through my pre-birth planning. So everything was ordained the way that it was supposed to be. I think that for me, I really needed to experience that contrast of trauma so that I could see what the light was going to be like in the end. And I think that, yeah, the trauma definitely made the spiritual emergency that I went through much more profound. It was very confusing to see things in a different way, to be put into full awareness from absolute unawareness. You know, like I was completely oblivious to anything outside myself and my drug addiction, and then to be opened up to a whole world of spirituality and completely unaware of how to integrate it. And thank God for the universe answering prayers, you know, because I was given so many mentors in my path and so much community once I was ready for it, to help me understand, to put language to my experience. I didn't have any language. I couldn't even speak for the first 5 months after everything happened. So, and now I can speak very eloquently about it. And that's through no doing of my own. That's just from source and my angels and guides. And yeah, thanks for letting me share.
Thanks. Emily?
So it's interesting. I would say that, you know, it's difficult for me to find really the source of my trauma. I would say it really comes from this sort of assumption that children need to sort of be molded into, you know, they're kind of a tabula rasa and they need to be molded into society, when actually I think children are born with a strong sense of self-concept. And I'm a very spiritual sort of elemental being, and I was treated as though I was somebody who had no understanding. So I think that's where the wound really was. But apart from that, I see my trauma as being very ancestral. And in a lot of the journeys that I've done since the first experience, I've lived through the traumas a long way down my ancestral line. So yeah, it's all of us carrying this burden.
Thank you. Marnie?
Yeah, I would say that the trauma that I experienced in losing everything, and, you know, even though it was by my choice as far as making a big change, I think that really was the catalyst for my spiritual awakening. But it doesn't really stop there, because it is a journey. It's a healing journey on my case. And I found writing to be very instrumental in helping me make sense of what I went through. And then it's very important for you to go back into your childhood, you know, to your maybe core wounds that you have, or intergenerational issues, to help understand, you know, what made you a target for an abuser, what made you an overgiver or an extreme empath, and that type of thing. So the trauma was definitely the catalyst, but the journey which has taken many years, I think is something that we need to consciously do. And just having that now understanding and foundation that there is much more to this earth than what I previously believed, that there is a divine realm, spirituality, that has provided me so much reassurance and guidance, and has really helped me, survive the trauma.
Thank you. Christina, do you want to respond?
I would definitely say for me, it's trauma has been a catalyst, but it's also really important to work through all that trauma. I come from having a narcissistic father and a complacent mother whose idea of resolving when he was being cruel to us, oh, honey, stop. I had an older sister who my father would pit against me on purpose. And there were times growing up where I honestly didn't think I'd make it past 13 living in the same house with her. But it takes a lot of working through, right? What I provide at Blue Lotus Network is a Healing Through Creativity art program that I created and facilitate. And I used it on myself a lot, even because as hard as the trauma is, it doesn't always go away. Sometimes it comes back in little folds and you have to deal with it again. That's why I loved Nicole Gruhl's talk about, how important it is to get in touch with your artistic child, that child within, to help work through those things. So mine was definitely a catalyst, but as difficult it was, I'm very grateful that it all happened, because I wouldn't be the person I am today, and I wouldn't have gotten the calling that was meant to be for me.
Thank you. So Mary Ann had a question. Let's see, where did she go? I'm not sure she's asking this generally of the group. Well, I can't find it, so I'm just going to go on. This question is for Christina. How is your husband? This is from Julianne. Christina, how is your husband now? Do you have any advice for supporting spouses experiencing spiritual emergency or recovering from a traumatic hospitalization?
He's doing well. We're still together. He's actually recently, he's actually recently in recovery for alcoholism. When I had my initiatory crisis, he got to the alcoholism really strong, and that was part of the trauma. But for some reason, it's kind of one of those things where, I managed to find a magical guy who's sticking with me regardless. And it's not to say we haven't had our problems, but he is the one who helped me find the alternative treatments, and he's the one who encourages me to go after my dreams regardless of having this issue. So I guess my advice would be to have those difficult conversations with your spouse. Ask them what they need, and how you can help support them through this, and have those difficult discussions, even if they hurt, on why that person maybe put you in the hospital in the first place, and how you have to work through the pain of your spouse putting you there. I still have that to this day. I've tried to be understanding that he was just doing what was best for me at the time. But then I also struggle with, had we had something different, that could have played out a whole lot better. So it's just having that conversation and working through those things together, and it'll make you stronger.
Great, thank you. This question is from Anne and for Marnie. Why is Marnie calling her book fiction when it appears to be a memoir based on her own experiences and demands in life?
Very good question, Anne. Yes, it's a spiritual fiction, but it was definitely inspired by true events. I was writing it after I had left my marriage, and there was a lot of fear involved. I'm dealing with, and still, even a decade after, still dealing with kind of a malevolent force that wants to try to destroy me in any way possible. And so I was very, very fearful about writing my true experiences. So I changed the names and the places, but a lot of the experiences, were definitely inspired by the real thing. Part of the reason also for the spiritual fiction, as opposed to a nonfiction, is not everything happened at this one garage sale. However, in the story, that's where it all takes place. So I incorporated, once you have a spiritual awakening, lots of times people end up going back into their previous years and realize that they might have had some other experiences that they didn't even acknowledge at the time. Even so many near-death experiencers, are talking about something that they had 10, 20 years prior, because it's just now coming to their awareness, the significance of everything that they went through. And then, I had read the Celestine Prophecy, James Redfield's book, and actually did some workshops with him, got to know him, and he was my primary endorser for the book. He was a role model for me in many ways, because he actually had real experiences and was trying to give a message out there about spiritual awakenings, but in a format that could be maybe accessible to people that normally wouldn't pick up a book and read about these kinds of things. So my book is pretty well received now, and I've had numerous book signings, and it's kind of all over the world. And it's part of it is because it's an easy to read book, and it's not always saying one person's true account of their experiences. I incorporated so many, but I would say most of them were mine. But that is the reason. The fear was part of it at the time, but also just the desire to reach an audience that normally would not pick up a book on spiritual awakenings.
Great, thank you.
Mm-hmm.
Betty, there were numerous comments like this. I'm just going to pick one to read and summarize, and if you can respond. So Face says, Betty, my heart is blown so wide open. Thank you for your courage. I love hearing about the spiritual opening occurring for you. This sharing means more than you know.
Aww.
That's beautiful. Thank you for sharing that. Part of my process has been to live without fear. I recover very loudly. I share about my spiritual experiences very openly in forums where that's not necessarily accepted, so I could share my story of recovery and my 12-step fellowship to an audience of 100 people, and maybe 99 of them don't necessarily know what I'm talking about when I'm sharing about my awakening. But one person always, will be like, oh, me too. And I get to connect with that one person and validate their experience. And for me, that feels just like heaven. It really does. It feels like eternity, and it feels so aligned, and every cell in my body lights up on fire. And so that's definitely been part of my process, is just standing very firmly in my spiritual truth and knowing that this is all for something bigger.
Thank you. So we have time for one more question, and I'm going to ask this of Christina. This is from the Doman family. Do you think now you had or have bipolar disorder?
I go back and forth with this question with myself a lot, actually. I don't have the typical ups and downs of mania and depression of a typical bipolar, of way things go. I think mine is more CPTSD with emphasis on like psychotic behaviors. Because I don't have ups and downs every month, or it doesn't cycle like that. For me, it cycles every couple of, like half a year, if and when it does occur. I actually had my most recent, and it was a Mania post conference. And I've actually recently just come out of the hospital for it, but prior to that, I didn't have one for almost 4 years. I also think there's a bit of religious trauma syndrome with that as well. I was always seeking spirituality from as young as I can remember. And a lot of this catapulted from me no longer wanting to believe in God. And it just kind of hit me that God exists. And I could no longer ignore that anymore from the experience I had. But there was a lot of religious trauma syndrome from churches I went to growing up, bad experiences I had at churches. And I think it all folds together like that. I don't think mine is full-blown bipolar disorder. It could be. I'm not discrediting that, but it's multidimensional and it's forever changing. And I don't always have the same experiences in the same ways. This last one was a rebirthing experience, to where I was nesting for a couple of days, organizing my apartment and cleaning everything up. And then I actually went into a ball and went through the room, making motions as if I was going through the womb in yoga poses. So for me, it's much more strongly that it's more a spiritually transformative experience.
Well, thank you, Christine. I want to thank all four of the panels. I think they not only were so informative, but they modeled for all of us how to speak with vulnerability and bravery and transparency. So thank you so much. I know we could go on and on with questions, but we're out of time. So thank you. And we're going to go to a break now, and the next program will start on the hour.